So we should go over, because you'll need to know this in talking to patients, what are the eligibility criteria. And Bill C-14 is in some ways much simpler than earlier versions of proposed legislation in that they do not allow for assisted dying for patients who are under the age of 18, for minors, for primarily mental health disorders, and they are not allowing for advance directives. This is the current eligibility criteria. You have to have health services funded by the Government of Canada. You have to be at least 18. You have to be capable of making healthcare decisions. You have to have a grievous and irremediable medical condition. This has to be a voluntary request by the patient, not by proxy, not coerced by anyone. And the patient has to agree to it and provide informed consent. And our protocol builds all of these components in if you just follow the protocol. So how do you determine grievous and irremediable according to the bill? You have to have a serious and incurable disease, and I think that's the key. You also have to be pretty close to the end of life, so you have to have this incurable disease and be in an advanced state of irreversible decline in capability. There has to be enduring physical and psychological suffering that's intolerable to the patient and cannot be relieved under treatments that's acceptable to the patient. So that's not our judgment, that's really up to the patient if they find something is intolerable and whether there's a treatment that they will accept. And then natural death has to be reasonably foreseeable without needing to specify what a prognosis is for that patient. And that is part of the controversy around the bill, that reasonably foreseeable isn't defined, but they're trusting clinicians to be able to make that assessment. So we'll see in the end, but as you can see, it's actually fairly challenging to determine when a patient meets these criteria because it is a little non-specific.